In reconstructive surgery, understanding the Mathes and Nahai classification of muscle flaps is essential for selecting the most appropriate flap based on its blood supply, ensuring both flap survival and surgical success. The classification divides muscle flaps into 5 distinct types, each defined by its vascular supply. Type 1. Single dominant vascular pedicle. Muscles in this group are supplied by a single dominant vascular pedicle, which means the entire muscle relies on one main artery and vein. While this makes the blood supply fairly predictable, it also limits the flap's mobility. For instance, the tensor fasciae latae and gastrocnemius muscles are common examples. These flaps are often used for smaller, more localized defects because their length and rotation depend on the pedicle's location. Type 2. One dominant and minor segmental pedicles. Type 2 flaps have one major vascular pedicle supplemented by minor segmental pedicles. This arrangement provides additional blood flow, which increases the flexibility of the flap. Examples include the gracilis, soleus, and sartorius muscles. These are ideal for medium-sized defects and allow for greater range and versatility in reconstruction, although the main blood supply still comes from the dominant pedicle. Type 3. Two dominant vascular pedicles. In type 3 muscles, 2 equally significant vascular pedicles supply the muscle. This dual blood supply offers more reliability and versatility for reconstructive use, particularly in areas requiring extensive coverage. The rectus abdominis muscle, often used in abdominal wall and breast reconstructions, is a prime example. Because it has 2 primary pedicles, the surgeon has more options during surgery and a higher chance of success, especially in larger reconstructions. Type 4. Segmental or multiple minor pedicles. Muscles in type 4 are supplied by multiple segmental pedicles, none of which are dominant. This type of flap requires careful dissection to maintain adequate blood flow and is generally considered less reliable than other types. Examples include the external oblique and tibialis anterior muscles. These muscles are not typically used for free flap transfers due to the complexity of their vascular supply, making them less predictable in terms of ensuring full blood flow. Type 5. One dominant pedicle with secondary segmental pedicles. Lastly, type 5 muscles are supplied by a dominant pedicle along with multiple secondary segmental pedicles. This combination makes them especially useful for more complex reconstructions. The pectoralis major and latissimus dorsi are excellent examples, frequently used for large and versatile reconstructions. The multiple blood sources ensure that even if the main pedicle is compromised, the secondary pedicles can support the flap's survival. In practice, selecting the right type of muscle flap is critical for successful reconstruction. Type 1 flaps, like the gastrocnemius, are often reserved for smaller reconstructions due to their limited mobility. Type 2 and 3 flaps, such as the gracilis and rectus abdominis, offer more versatility and are commonly used for moderate to large reconstructions. Type 4 flaps are generally avoided in free tissue transfer because their complex vascular anatomy makes them less reliable. Type 5 flaps, like the latissimus dorsi, are highly favored in complex cases, offering a robust blood supply that ensures the flap's viability in large reconstructions. Ultimately, the Mathes and Nahai classification allows surgeons to tailor their approach to each patient's unique needs, ensuring the selected flap has a reliable blood supply for long-term survival and function. This classification has become a cornerstone of reconstructive surgery, providing a structured method to select flaps and minimize complications.